So, Bill, nice to meet you here again on the HIMSS. And I want to point out a question about the actual innovation side of Microsoft. What is the message, the actual message on the HIMSS 2012?
Well, the message, and it's not just this year. I think Microsoft for years and years has been all about innovation. But innovation is actually one of our big buckets in our solution areas. We talk about secure and connected infrastructure. We talk about collaboration. We talk about health data modernization. And that fourth big bucket is innovation. Microsoft spends about $9 billion US a year on applied research across the broad horizontal technology. So over the past 3 years, that's $27 billion of investment in research. Out of that research comes a lot of innovation. One of my great pleasures of my job is being able to go to Microsoft Research several times a year, work with the researchers there, and look at what they're doing. And although a lot of that research has nothing to do with healthcare, it is amazing how much of that research ends up spilling over into healthcare. I'll give you a couple examples. Several years ago, we introduced Surface computing. Surface was not designed with healthcare in mind, but around the world, our partners and customers looked at the technology and started thinking of ways that that user interface would come in handy in healthcare for imaging and collaboration and other kinds of things. Now we have Surface 2.0. You can hang it on a wall or you can put your feet under it. That's very cool. The biggest thing right now that we're hearing from healthcare customers and researchers around the world is the Connect effect. So our interactive entertainment group comes out with technology for the Xbox. It's just all about video gaming and selling millions of video games. But guess what? Researchers, clinicians, doctors, nurses, they see this technology and they go, well, what about in the operating room where we don't want to touch things and need to maintain a sterile field? Or what if I'm doing a procedure and need to get at my information? Or what about patients or consumers in their living rooms? And first of all, there's the sort of the health spin-off of just getting families off the couch, getting them playing together, getting them active in front of the screen. We're seeing lots of that. Kids gravitate naturally to Connect. But again, partners around the world are looking at it and saying, well, if it can do all that, what about rehabilitating in physical therapy, rehabilitation? What about specific exercises for the elderly? What about children that might have a learning disorder and so forth? And there are a million ways that are playing out. If you go on YouTube or onto Bing and you do Connect and healthcare, you're going to see the Connect effect, and it's huge.
That's great. Let me pick up one sentence when you're talking about connecting people. Yes. The headline of the HIMSS this year is linking people, progress and potential. What does this mean out of a site from Microsoft?
I think it means many things, and I actually kind of like the linking people because that kind of plays into our Microsoft link. I'm sure they didn't intend that here at HIMSS, but nonetheless, for years I've been evangelizing the importance of communication and collaboration in health and healthcare, not only amongst care teams and within our institutions, but increasingly we're being asked to have those lines of connectivity with our patients wherever they are, in extended care facilities, in nursing homes, and in their own homes, using technology and communication to help them age in place. Extraordinarily important. So it's all about how do we leverage the power of unified communications, how do we leverage the power of software to connect people around the globe and engage them in health, and do things and scale healthcare delivery in ways that were unimaginable just a few years ago. You've heard me talk before probably about telemedicine. Well, telemedicine, we were doing that back in the 1950s, right? But telemedicine today is commodity. A doctor or a nurse with a laptop and some connectivity and smart software like Link and perhaps Skype can be a global telemedicine provider. So that's what really excites me as we look at ways to scale healthcare services. We have this triple aim today: faster, better, less expensive. That's one of the things that will allow us to do that.
Okay. Yeah. How many years we will see telemedicine as an ordinary part of our life?
What's really interesting about this, and I think this is true in Germany and across Western Europe as equally as it is in the US, even though there's some differences in the way healthcare is paid for and funded. We have technology today to do almost anything we want to do. What I find and what I write about a lot as I travel the world is what holds us back today is not the technology. What's holding us back is business models around that technology, leadership, clinical behaviors to some degree, and more importantly, the regulatory environment. I mean, we really need to kind of rethink healthcare delivery and the ways we deliver care, and be able to engage clinicians and others in business models and reward systems that allow them to do this. We tend to put up barriers, either barriers by not reimbursing for telemedicine, or barriers by regulations over certain lines or districts or across states. Those are things that our EU leaders, those are the things that the regulators, the lawyers, the legal people really need to sit down and think through. If we're going to reach that triple aim of better, faster, less expensive care, technology is the path, but that path has to be cleared before it can happen.
Okay, Bill, thank you very much.
You're very welcome.
I'm looking forward to see you in Europe soon.
I will be at Vitalis in Sweden, and I will be at WOHIT in Copenhagen.